there, my name's Kristina. I'm your pharmacist here at Holyrood Pharmacy. And in case you missed my video on sun protection, today we're going to go through how to treat a sunburn. In the first 24 hours of getting a sunburn, the most important treatment includes using a cold compress or a cold cloth, as well as anti-inflammatories. You don't want to use ice on the burn because it can constrict the blood vessels and irritate the burn further. Over-the-counter anti-inflammatories include naproxen and Ibuoprofen. Both work well for a sunburn. If you're a patient that is unable to take anti-inflammatories, you can still use acetaminophen as it will help with the pain. It just won't provide any relief from the inflammation. In addition to cold compresses and oral products, you can also use products known as skin protectants while your burn is healing. These are especially useful if your burn is going to be under clothing. You can use Vaseline products, cocoa butter products, products containing allantoin, or a combination of the three. The only product we really suggest not using is an old wives' tale, butter, as it can provide a breeding ground for bacteria. Aloe vera is another popular product we see for sunburn. Aloe vera can be quite soothing, just make sure that you're using it only on unbroken skin. If your sunburn is more severe and you have some blistering, you want to make sure to try to keep the blisters intact and keep the area clean. You can do so by washing it with antibacterial soap and water. If you are showing signs of infection, it might be worth following up with a physician. If you experience any itching while your burn is healing, you can use an oral antihistamine such as diphenhydramine or a non-sedating one like desloratadine. Next, I'm going to touch on some products that we don't actually recommend for sunburn. The first being diphenhydramine cream, as it can cause you to be more sensitive. The second one that you don't often see recommended would be polysporin. This is because there's no additional benefit to putting it on a sunburn that has no infection, and it's often not strong enough if the blisters are infected. Last, we don't often recommend cortate cream, as steroids can actually impair the healing of your sunburn. If you have severe blistering or any signs of sunstroke, including weakness or confusion, be sure to follow up with a physician. Once you've treated this sunburn, it's important to remember not to get another one. You can always refer back to my sun care video to find out how to prevent further sunburns. Thanks, and I hope this was helpful.